Hi, my name is Mohammed Sarwar and welcome to our CWTC Get Connected Community Podcast to share our experiences, promote services and networking and great opportunities available for residents of Oldham. As you know, we all go through different experiences in our health and social care, whether it's positive or negative. So who can you approach to share your experience you had and even help to improve standards of care? Today, we have invited Tamoor Tariq, Manager of Healthwatch Oldham, a statutory service which has the legal powers and is commissioned by Oldham Council to help residents of Oldham to share their experiences to improve their care. Tamoor, welcome to our studio.
Good afternoon, thank you for having me.
Oh, my pleasure. And how are you?
I'm really well, thank you.
Excellent. It's been a long time trying to get you to our centre here, but it's a pleasure that you are here and working away with Healthwatch Oldham and helping the community at large. Mm-hmm. Well done. Can you tell us about your experiences, your career?
Yeah, so I've been with Healthwatch Oldham as the manager since August 2020. I joined at the, what I would describe at the height of COVID or just after the height of COVID. Yes. Quite a challenging time, but I think a very symbolic time in terms of enlightening the challenges we've got around health inequalities. Yes. And really showing how during COVID-19 a lot of the communities from especially those who kind of identify themselves as experiencing racial injustice, who come from the ethnic minority community, how during COVID they were significantly highlighted as being disproportionately affected, which I suppose made the role of Healthwatch, my role, the work of our team, that more important to ensure that seldom heard voices come through on a more regular basis, and we're able to challenge providers and commissioners. Before I did this role, I was in the voluntary sector over in East Lancashire. I was the Senior Project Officer for Lancashire BME Network based in Blackburn, and my role covered the whole of the Lancashire footprint, though predominantly our base was East Lancashire. And there my role was to coordinate projects on behalf of the organisation, and there were 6 projects that I was in charge of coordinating, as well as running my own project, which was around providing infrastructure support to community groups and community organisations. So support around governance, funding, financial arrangements, growth strategy, all that kind of support. So that was my last role, and then I've kind of come closer to home here within Greater Manchester.
Welcome, and lots of experience there, and my passion for the voluntary sector, as you know, 30 years. Yep. And maybe we'll be able to tap into your good knowledge around the work we do also. In terms of health and inequality, that's touched upon many times, and it's about how people can address it, how can they improve it, etc. And I think it would be good to ask you, what do we actually mean by the Health and Social Care Act 2012, and who's it aimed at?
So the Health and Social Care Act 2012, and a lot of local people may remember this legislation because it was quite well known, well publicised, and quite topical at the time. In fact, in some respects, it was quite controversial. It's the last set of legislative changes that the government, significant changes that the government brought in around NHS reforms. And what we've had since 2012, the other changes that we've had in the last 18 months to 2 years, is a transition from CCGs to the ICS, the Greater Manchester ICS arrangement. On a locality basis, that's meant now we don't have CCG teams, we have what we call an integrated care partnership, ICPs. So that's like a decade on, that was the next set of changes. But in 2012, the Health and Social Care Act, why that is really, really important to Healthwatch is that led to the creation of Healthwatch. So really, we've only been going just over a decade. That's not to say that before 2012, there wasn't a platform for patients to have their voices heard, and for patient experience and patient voices to come through a local system. That avenue was absolutely there, but it was there via what people may remember as the link. again funded via government through to local councils, which was then commissioned out to providers within any specific local area. So Health and Social Care Act has led to the creation of Healthwatch and allowed us really to develop and strengthen the patient voice and patient experience in each locality.
And I think a lot down the interview or discussion we're going to have is to talk about how people can actually voice their experiences. So the Health Act is a framework for the integrated services to work upon. So as one of the statutory functions that Healthwatch Oldham has is to gather those views of people about their needs and experiences of the local health and care services. How do you actually collate those views and experiences of people?
So what we try to do is we try to do a minimum of 4 surveys in a year with the local community. And the challenge for Healthwatch is ensuring that in any given year that we are improving the accessibility that local people have to Healthwatch. So that means whatever survey that we are presenting to local people, we're actually able to have a new reach, a more wider reach, and we're able to involve new people into our work and engagement. And in order to do that, we do need the trust and confidence of the local community for them to have faith in the work that we do. And we do this by having networks of like yourself here at CWT and also with other community groups and organisations who work with us to try and get access to the grassroots of our communities.
It's important, isn't it, because it's a community issue, so everybody needs to take part.
Absolutely. And this is the strength and the value, I would say, of Healthwatch, that the more voices we have, the more responses that we have, the stronger our data and our reporting to providers and commissioners. That's what's going to lead us to have better outcomes and have a better impact, which is ultimately what we're here for. The way that Healthwatch Oldham is hosted and the way it operates is somewhat different and somewhat unique to many health watches across the country, in that we are hosted by Action Together. You'll know that Action Together is an infrastructure organisation working across Oldham, Rochdale and Tameside, and they do a significant amount of work in terms of empowering community groups, community organisations, strengthening them, growing them. And why that is a huge opportunity and a huge avenue for us is that they often have access to individuals within the locality.
Think with your experience within the voluntary sector and experience with Healthwatch, it blends in very well, because you understand how the community networks work and how can they support your services as well.
Absolutely, and to be honest, that's one of the reasons why I went for the job. I felt it was a natural fit in terms of having that experience and that interest in the voluntary sector, but also applying my skills and qualities to a role that's slightly outside of the voluntary sector. But because as a Healthwatch, we are a consumer champion of health and social care services with separate statutory powers, as you say, set out in the Health and Social Care Act of 2012, but we're able to work in the parameters of having those really good relationships with the local community, which comes as a result of being hosted by Action
and that's
Together.
very important for our viewers and listeners to know, that while you have these statutory powers, which means that your service can hold those service accountable, how they deliver and what difference they're making to the community. And I think it's important to know that while you have those powers, but it's about building the relationship to improve things.
Absolutely, and I think this is really, really key. And myself and the team are always looking at this. It's not about coming down hard on providers or commissioners or pushing around our influence.
These are difficult times as well.
Absolutely. Pushing around our influence as a local watchdog. I think we get the most out of providers and commissioners if we're able to build those relationships, kind of be on an equal footing, as it were, understand one another, have that open relationship, that honest, transparent relationship, and really not have any surprises in the way that we operate. So what we try to do is, before we do a survey or a piece of engagement, we'd like to notify providers and commissioners that this is the piece of work that we'll be working on. We often will ask for their intent what would they suggest that could help get the most out of this. We will then continue to liaise with them once we do our findings on any particular survey. We submit the report that will then come back to us as a response in any different way from a specific provider or commissioner as to what changes they will bring about as a result of something that we have had an impact on or suggested or recommended in our report. And that goes to the heart of what we do day in and day out, because we can only be effective if we are that voice of local people.
Absolutely. And coming to the next point is the voice of the people, the information that you gather. What are the main concerns and needs of the people of Oldham residents?
So if I was to summarise the concerns of what's happening in Oldham, I would absolutely put primary care and the access to GPs up there as a crucial issue to local people. It's something that now, absolutely at the height of COVID, we saw the trends from our intelligence telling us this. The situation, unfortunately, somewhat things have changed in terms of circumstances, but the principle of the issue remains. There remains significant challenges within our primary care setup, and the way that GP practices are able to deal with and manage patients has become challenging. And therefore what we try to do in the meetings that I attend as the manager, strategic meetings, so for example the Primary Care Commissioning Committee here in Oldham, the Health and Wellbeing Board, the Health Scrutiny that the council, the committee that the council has, throughout the locality board, ICP partnership board, whatever meetings that I am representing Healthwatch in, we will try and raise the profile and raise the issue around primary care and the access to GPs. The other one, which won't be a surprise, is also a national issue, just as access to GPs is the access to dental care. Right. This is a huge issue, significant pressure on local residents and local families, as we understand that there is pressure on the local dental setup here as well. Again, we're working with colleagues from across the different Greater Manchester Healthwatch organisations as part of the Greater Manchester Healthwatch network to raise this issue collectively with Greater Manchester commissioners, also with the NHS England and with the Department of Health, to ensure that the voices of local people here in Greater Manchester and here in Oldham are heard around dentistry. In the last few months, I've had a meeting with Debbie Abrahams, the MP for Oldham East and Saddleworth. I've also had communication with the other two MPs, Jim McMahon and Angela Rayner, on the important issue of dentistry. This does need to be raised in Parliament. There is focus from the Health Select Committee on dentistry as well. Healthwatch England have it as one of their priorities, and it absolutely is a priority for us here in Oldham and across Greater Manchester. So dentistry is another key issue as well.
Is it one of the points where the recruitment to the dentist is difficult, or do we just need more dentists?
I think there's a mixture of things. There's an issue, for example, with the way that the contracts are commissioned from NHS England. And what I mean by that is ultimately from a lot of dental practices are businesses effectively. And it is more attractive to them to look to carry out contracts within the private sector than it is to take on patients within the NHS. And absolutely there's been a lot of noise around changing the contract arrangements nationally as far as dentists are concerned, but more needs to be done to enable local systems here in both Oldham, Greater Manchester, and across the country to reduce the demand on the wider dental system, and to make that access for individuals to become an NHS patient that more easier. I think the crisis in dentistry is twofold. One, in terms of the impact on young people and children, and the more time that passes where they're not able to get treatment or be seen, their issues, their concerns and their situations worsen as a result. And then we have also adults who may have underlying health conditions, and due to issues around dental care or dental hygiene, things are worsening as a result. So access to dentistry remains a huge issue. The solution lies nationally. There needs to be more investment. And actually, I think that there needs to be more of an avenue for local people to have their voices heard around dentistry. I think there's a more scope for dental committees to be listening to the patient voice and patient experience of what's happening on the ground, and so we can have the dental community working with us hand in hand to ensure that changes are brought about.
I think this could do with another episode with us of how the integrated services can be improved and how this system works, and look at the framework in more detail. So this brings us to the question of what does Healthwatch provides besides what we discussed about what other services are available to the residents of Oldham.
So we don't provide direct services in that respect. We're not, for example, an emergency service. People, for example, who have experience of hospital care will go to PALS, the patient liaison service within hospitals. There is scope for people to raise issues that are in case of an emergency through different avenues. So, for example, NHS 111, and incidentally, we have just concluded a project working with Oldham ICP around NHS 111, understanding people's experiences. We did used to offer the complaints and advocacy service, the NHS complaints and advocacy here in Oldham, but as of 18 months ago, we don't have that service anymore. That's been tendered out to a different provider. So what we aim to do is continue to promote our surveys, promote the issues that are relevant to Oldham residents, and we're always trying on an annual basis to diversify our reach, increase the engagement and the involvement of
that
Healthwatch.
reach and the engagement. What platforms do you use to reach out?
So
because I think it brings me to the next question, which we can align, and that is there are many communities that exist in the borough, and they have language and cultural needs. So that reach, how does it actually complement?
I think that's a really, really important question. If I give you, for example, the survey we've just concluded on NHS 111, we were able to provide that survey in 4 different languages. We were able to, the level of engagement, the demographics of our engagement, hopefully will sample and give a good representation of the local community in Oldham. The challenge for us is that we need to continue to do that in every piece of engagement that we do, because I think that's really, really important. Significantly up to 30% of Oldham's population now is from an ethnic minority background, or communities who face racial injustice or seldom heard. And it's really important that those voices come through, because as COVID-19 has shown, that they are disproportionately impacted by inequalities in the health and social care system. So what we do is we try and promote our surveys. We work with different community groups and community leaders to ensure that publicity is there and we're able to get that response. Sometimes we're able to work in partnership with community groups and community organisations through funding that may be available. That's very, very limited, doesn't happen that often, but we have had examples of working in partnership, of having some form of semi-formal relationship around delivery of a project. And what we've seen is that leads to strengthen communication, strengthen responses, and has more of an impact in terms of the work that we do. In terms of how people can get involved, so we've got a website, we have a social media presence on Twitter and Facebook, we have a regular e-bulletin, a newsletter which we put out every couple of weeks. Again, that gives the flavour of the recent activity that Healthwatch is engaged with, and also we have access to a wide range of community groups and networks that help us cascade our information and our messaging and our work down to the communities.
It just gives me an idea that we can actually work together when we have cultural events here, for example, and because you're bilingual, it would help to come in and present a 15 minutes of your work that you're delivering in Oldham.
Absolutely, and I would absolutely love to do that. And
Brilliant.
I think it's really, really important that Healthwatch is adaptable, that it has that reach across all of our communities. And, there is no getting away from, there are certain parts of Oldham that face stark challenges as far as health and social care is involved. And one of the things that I always remind leaders of within the health and social care system, in attempting to work with them, in attempting to hold them to account, one of the things I remind them that during COVID-19, during the vaccination time, you will have seen, and local people will have seen, health and social care leaders were very much out in the community. They were opening doors for whether it was local faith groups, faith organisations, the Council of Mosques, whoever it was. You were able to see these vaccination clinics almost be very much accessible to local communities. My challenge and our challenge as Healthwatch to the system is that if we can have that way of working and that level of accessibility and that grassroots approach during COVID, that shows that these communities are not hard to reach.
No, we can do it.
And we can absolutely do it. And that's the challenge, really. The system can no longer say, we tried X, Y, and Z and it didn't work. Because during a global pandemic, during an emergency, these things were tested, they were tried, and they absolutely worked.
And we people are willing together to engage as a society.
Absolutely.
And I think that's very important. I mean, we all know NHS and social care staff are doing their best in difficult circumstances, especially during the COVID. That can be that principle or practice can be carried forward, but it needs to be done as a society.
Absolutely.
Because we're coming to a close for the discussion, and there's a lot more to discuss. Volunteers are a great way of building, knowledge and skills in the community. Do you have volunteers within your service?
So we have a very small group of committed volunteers that we've had for some time, and we are very fortunate to have them. We're very dependent on them, and we're very grateful for the work that they do. So every time throughout a particular point in the year when we have a number of big events, our volunteers are absolutely crucial in helping out, in supporting the facilitation of the planning, the organising, and in publicising our messages as well. One of the things that we're looking at, working with colleagues across the Greater Manchester Healthwatch network, is seeing how we can diversify the experiences of our volunteers. So for example, if there's a local person here in Oldham who's able to get a volunteering opportunity from a certain aspects of Healthwatch Oldham, but there might be something another Healthwatch in Greater Manchester offers that they're interested in, there might be an opportunity where we are able to share our volunteering pool. And the other thing is we have just implemented a policy around enter and view. Enter and view is a very important statutory power that's given to any individual Healthwatch via the Health and Social Care Act of 2012. And what this does, it allows Healthwatch to take the initiative to go into any health and social care setting to carry out an enter and view activity. And this basically means that we're able to go in and be the eyes and ears of local people. So for example, we were involved in partnership with Healthwatch Rochdale. We went into the Royal Oldham Hospital maternity unit based on intelligence that had come into Healthwatch Rochdale about some of the issues within that unit. Now, why we were involved is that Royal Oldham Hospital maternity unit is used by Oldham residents as well as Rochdale residents. Now, this was the first enter and view activity that Healthwatch Oldham was part of, but it was very, very important because Healthwatch Rochdale led on everything. They organised everything, and we were able to observe how an enter and view is carried out, what work it entails, and I think that's really, really important. And one of the things that we do want to do is look at how we may use volunteers in the medium to long term.
Was the outcome successful?
Well, yes, in the sense that we were able to collate information, we were able to gather intelligence, we were able to observe. This went into a report. The report actually, as we speak, is with the management of the hospital, and in the first week of December we are expecting a response to that report, and hopefully that piece of work, when we come to learn what the response will be, will show impact and outcomes of an intervention that Healthwatch Oldham and Healthwatch Rochdale were involved in. And I think it will be a good example of how we've used one of the powers that we have as a Healthwatch to be quite visible.
Again, it's all about understanding and improving things.
Absolutely.
And we all need it. And we need, again, to work as a society, really. Anything else you would like to add we possibly have missed?
No, I just want to add that we have just in the last few weeks recruited a new set of colleagues to our advisory board. They are colleagues who are very well known in the local community. They have an awful lot of professional and life experience. They come from diverse backgrounds, and I'm really, really enthused and excited about the contribution that they are going to have in the planning, the activity, and overseeing the work of Healthwatch Oldham. And I hope that in the not too distant future, local people will be able to see the impact and the work and the difference that the new colleagues within the advisory board will bring to Healthwatch Oldham. And if local people would like to know more or would like to get involved in helping us promote the work that we do as Healthwatch Oldham, then they are more than welcome to get in touch with us. Our contact details are available on our website, on social media, and I'm sure they can contact us through yourself as well.
Lovely, and we will insert your contacts on this video as well. Well, thank you very much, Tamoor. Lots of information there and lots of great work happening for the community of Oldham. And at the same time, it's very important for our viewers and listeners to get engaged with Healthwatch Oldham, to take your experiences forward with these integrated services, and let's work together as a society. Tamoor, thank you very much. And by the way, what do you think of our media department and the
amazing
podcast?
You've got an amazing professional setup. It's really good.
Thank you so
much. And I
much.
wish you all the best.
Thank you. Well, it's a platform to reach out and bring your services into the community. Thank you so much. Take care. God bless. See you soon.